alternative for neuroma surgery if you have nerve types of pain. Today's patient, slightly different than a typical neuroma. She has a Charcot foot secondary to diabetic breakdown. So she has a superficial nerve here on top of her foot, superficial deepish kind of, that causes pain occasionally. So she comes in, what, every 4 months or so?
Yes.
Give or take. We do cryo on her. She gets complete relief. Up until this point, it's pretty much been the only thing that's given her relief. So we're happy to do it for her and get her feeling better. So we'll kind of walk through it slowly with you. First, we take a little blade here, and we just do a little stab incision kind of right over the spot where she's having the pain, just to get through the skin. All right. I'm going to take the probe, please. So now that we have our little incision where we're going, obviously we palpated first, numbed her up before we did this, so we know where we want to go in order to get her the relief that she needs. So this itself is the cryo probe. All right, so the very tip here is what actually forms an ice ball in essence. So we're going down to the point where the nerve is. Since we've done it so much on her, it's relatively repetitive, so we know what we're doing. But for most neuromas that we do it on, it's ultrasound guided, so we can really make sure we're at the right spot. So what we'll do is we insert the probe here into the foot. All right, we kind of go down. You feel a little bit of a give, and then we know we're kind of in the right spot, again, for her specifically. Tim now is going to start up the machine here. And you'll hear there'll be a little bit of a hissing noise with the machine, so it helps us know. And then once the machine gets going, it's 2-minute cycles, so we do a 2-minute freezing cycle directly on the nerve, and then it's a 30-second break basically to let the ice ball kind of melt a little bit, and then we do a second. What's that?
Green to green.
Okay, good. Then we do a second 2-minute interval again for the second freezing cycle, and then that's it. For most neuroma patients afterwards, what we'll also add in is PRP, which is the platelets, and then ozone. For this patient specifically, we'll just use ozone. She didn't get a ton of relief from the PRP in the past. So once it's done, she'll walk out of here. For most cryo patients, again, this patient right here is kind of the exception. Typically, it could take multiple months before they truly see any relief. Again, about an 80% success rate with the cryo. So if you or a family member have a neuroma, you don't want to go the typical surgical route and you're looking for other conservative methods to potentially have done, give us a call. We do have patients coming from out of the state and out of the country, from as far as Africa to Asia to Europe. So don't ever think that you're too far away to have this done. But give us a call, like us on Facebook, on YouTube, follow